Thank you, Tony. And I'm going to have a little bit of a talk about smart technologies. I'm going to acknowledge Mike Ray, who's in the room. So Mike is fundamentally, together with Trevor and some of the team, been driving the rollout of Good Sam in Victoria. And so I borrowed some of Mike's slides, which he's very generously allowed me to do. So thank you, Mike. So you'll tell his ones, they go red. Okay, so maybe just to set the scene a little bit, just as a reminder around the issues of early defibrillation, and I think all of us know this. The quicker we get defibrillated, the better. The quicker we get CPR, the better. And Peter's talk yesterday was brilliant on that, in helping us understand some of the science that's sitting behind that. We know that public access defibrillation programs can save lives. There's good evidence around that, and we know that AED application prior to arrival of EMS improves the likelihood of hospital discharge following cardiac arrest. So the community are really critical for what we do. And if you have a look at the Victorian context there, you can see that over the last few years we've seen bystander CPR almost doubled in the last decade. So people are doing more CPR. We're seeing, obviously they have a high survival rate based on the data coming out of VACA. We've seen a 600% increase in the use of AEDs in the last decade. And last year, 80 Victorians were defibrillated prior to arrival of an ambulance by a public access defibrillator. And if you have a look at the slide there, which similar to what Michelle showed earlier, and I move across the public access side, you can see that for those defibrillated in the community, 65% of those are getting to hospital with a pulse and 45% of them are going home. And I think yesterday, Freddie talked about the fact that I think 50% of those are going home in Denmark. So the best survival rates we get of any population, in fact the best survival place in Victoria to suffer cardiac arrest is Melbourne Airport. Every couple of hundred metres is an AED and lots of people wandering through are happy to use it. You get best survival rates from cardiac arrest. So how do you systemise that? So this has been fortuitous. This has been rolling out public access defibrillation, as I'll talk about in a second, and hopefully people will come across AEDs or be alerted there as one of their location using some of the more early systems that we put in place in Victoria. But what we've seen over the last few years as things have changed, if you like, that we've seen a move around from the situation where it's a fortuitous come across someone in the street to a situation today where technology is disrupting the way we think about things, and it's disrupting the way we think about everything in society today. I just have to think back to 10 years ago. None of us had smartphones. The world is shifting at a great rate of knots, and technology is doing some quite interesting things. And in the resuscitation space that we're hearing a bit about the last couple of days, that's exactly the same. So there are lots of products that have evolved out there. I have to acknowledge that WA was first off the rank in Australia around this, and while we're all talking about these things, one of the great things WA often does is just get on with stuff and does it, and so they deliver some really good innovative ways, and we look across the other side of the country and go, oh, geez, that's pretty good. We might steal a bit of that. So we identified that there needed to be something to systemise our response to cardiac arrest for the community. So we went out to tender for a product and selected Good Sam, and Good Sam is now, as I'll talk about, being rolled out. It's one of the key points coming out of the 10 steps as we're talking about today. And one of the key things is that it must be integrated with the emergency medical service. So there are some places I still hear about around Australia and around the world who are talking about running local systems. You're wasting your time. If it is not integrated with the CAD system, it's a waste of time. So it's got to be, the ambulance services have a critical leadership role in actually working with communities around this, but have to drive it, have to connect it to CAD. Otherwise, it's a really nice repository of AEDs that someone may or may not choose to use in an emergency. So how Good Sam works in Victoria, again, when 000 comes in to our Emergency Service Telecommunication Authority, it's identified at the point of call through MPDS. I'll show you the determinants that we've applied in a minute. We don't directly control the CAD, so we've got a feed coming out of CAD into our organisation, and then we control Good Sam's utilisation. So it's a little bit different to how it might work if you control your CAD, but it just, in our organisation, and in our environment of Victoria, it actually we would still be trying to get that in, I think, if we were working with the other agencies. So we've taken the feed and done it ourselves. It alerts the 3 closest responders within a set distance. It's 400 metres within urban parts of Victoria and 5 kilometres in country Victoria. the responders either accept or reject the alert. And if they accept the alert, it provides case location and any nearby AEDs are identified as well. If they reject it, the next closest responder is alerted. When they respond, take the AED to the patient. And it's as simple as that. And it's now become an integral part of our improving cardiac arrest survival. I use the term game changer, and I really mean that. I think we've got 5 million Victorians that potentially could be part of our response system in Victoria in a coordinated way, shape or form. So this is the thing that will change, in my view, in the short term in Victoria, our biggest return on investment for improving cardiac arrest survival. So the event selection methodology, if you want to understand this in more detail, again, when we're doing question things later, Mike, I'm sure will be happy to talk to this. He's lived this, so he can answer some of the more technical questions. But basically what we've looked at is to identify those determinants that were high accuracy for cardiac arrest, where there's a high likelihood based on our data for resuscitation attempts by paramedic. The principle is to maximise the number of cardiac arrests but minimise exposure to scene safety issues and to potentially traumatic or highly stressful events. Things such as we talked about before, people that are clearly deceased, hangings, etc., they're not being responded to. So the governance, and this is something that Trevor, and the team have done a lot of work in. It's easy to say it's a technical solution, we put it in. The benefit of Good Sam working for us is around the governance and work that's gone behind the scenes. So we've developed a trusted code of responder code of conduct, which everyone who signs up to Good Sam as an agent of AV, a trusted partner of AV, has to agree to. We've developed the automated workflows based on AMPS event types I talked about before, integrated them with existing dispatch workflows. This is just part of it. It just becomes routine and normal. It doesn't require someone's intervention. I've talked about the exclusions, so we have inappropriate locations where there is inappropriate patients, so for example, a person that is clearly deceased, or there are known scene safety or occupational violence issues around that scene, then we'll be monitoring the call during an MA cancel, the Good Sam dispatcher if that comes up, or the responder. And importantly, as we've done with our first firefighter and other first responder programs, there's a first responder telephone follow-up. So they're following up every person that has responded to make sure that they're doing okay. So there's a telephone call from someone within the team. And there is also provision of additional support, so we can guide them to other mental health services in the community if they're seeking to have some support following the event. So unlike a normal cardiac arrest, someone who signs up to Good Sam is actually followed up beyond the event in a way that we haven't been able to do before. We also provide, as I think Mike talked about this yesterday, AET data retrieval, so we're taking data from the AED, but in part of that we're recommissioning it. So we're providing the AED pads, recommissioning the device and making it back to normal again. So again, removing any barrier that might be there for someone that may be considering whether I do or don't want to have my AED as part of this team. And a formal evaluation undertaken by Karen and her team, which will be completed in the coming months, which will guide next steps, beyond the trusted partners. At the moment, it's rolled out to all of our staff, to a number of response agencies. You can see them all there at the launch, our fire services, all health professionals, ARPA registered health professionals, Life Saving Victoria, St John Ambulance, who's probably one of our highest uptakes of it, and a range of other organisations. The next step for me will be the rollout beyond to the more broader community, first aid trained members of the community. But that's a big step. So I want to get this right, I want to make sure everything's working okay, and how do we make sure that we've got the systems in place so if there are 400,000 Victorians on day one want to sign up to Good Sam, that we're actually ready to support it, because our reputation will fall over very quickly if we can't. The technical element is probably the easiest. Mike would disagree with me, I'm sure, but the easiest element of this. The benefit of Good Sam and the benefit of first responder apps is engaging the community. So it is about a communication engagement activity more than a technical activity. If you treat it as a pure technical activity, you will never get the numbers you want to get on there. So there's been a lot of work put behind the scenes by our team around this communication engagement. So the first stage rollout for us was around the AED registration, engaging defibrillator owners to register the device with us. So we're getting our defibrillation registry and Good Sam AED registry populated. Responder recruitment, so invited our workforce to sign up first and then tested that for a period of time, then rolled it out more broadly in a public launch which was attended by the Premier and others. The big thing for us has been patient stories. We've had some very powerful patient stories early on. Probably the Keith you can see on the bottom left-hand or your right-hand side there was the first story. One of our paramedics heard this strange thing going off at home, thought he stood on one of his kids' toys, realised that his neighbour across the back fence had suffered been alerted to a neighbour with this potential cardiac arrest. Jumped on his bike, rode round the corner, and sure enough, this guy's in cardiac arrest, and he continued resuscitation until the ambulance got there, and this guy's had a great outcome. Probably the most powerful one for me is the one on the left-hand side. So that's Andrew Crellin. Andrew's an emergency physician in Ballarat. Andrew's 48 years of age, and Andrew went to the toilet one morning at 4 o'clock and suffered a cardiac arrest. One of our paramedics who'd signed up to Good Sam, who was a few hundred metres away, rocked up at his front door in her pyjamas, and the term is used there, his angel in pyjamas, to work with the family to resuscitate Andrew, and he's doing very well. So these are very powerful stories, particularly within the broader health workforce, about understanding what difference it makes, because it's not about the technology, it's about human lives. That just gives you an example of some of the media that we've got out of it. It went gangbusters. It was fairly huge and created a strong sense of understanding and knowledge of Good Sam in the broader community. To date, our results, you can see there, we've got 600 AEDs in the registry, added to the registry since. 33% of our operational workforce has signed up, and we've got 3,500 verified responder partners and growing every day. Importantly, we had 740 pieces of media, and we had an predicted reach or identified reach of 110 million around the world through the media activity that occurred with the launch of Good Sam a few months back. Good Sam activity, there's Andrew there. So we get about 20 Good Sam alerts per day. 740 responders have been notified between January and July. 145 Good Sam responses and 34 responders have provided care. 2 lives saved. Well, I see a couple of others popping up in the report I get. So, but there's at the moment identified 2, and most likely to be more that can be directly attributed to the role of Good Sam. So it's making a difference already, and in essence, reducing time to early CPR and early defibrillation. I'm just going to show you this quick video towards the end, and then I'll hand over to the next speaker. But this is just an example of some of the outreach that we've been doing.
It was half time.
I walked around the gym for a little bit.
I was playing soccer.
My legs just gave out from under me.
I felt really dizzy
and collapsed.
I was unresponsive.
And I had no pulse.
I had a cardiac arrest.
Luckily, a couple of my teammates knew what to do.
Someone got a defib.
The guy started CPR.
The defibrillator restarted my heart.
When someone is in cardiac arrest, every second counts. The sooner somebody receives CPR and defibrillation, the greater their chance of survival. Saving lives is always a team effort. That's why we've partnered with Good Sam. It's an app that alerts off-duty professionals like you to cardiac arrests nearby. If you're a medical professional or qualified first aider, please join us. Register as a trusted Good Sam responder today.
If those guys hadn't been there, or if they hadn't been able to get a defib, I wouldn't have survived.
Thank you, and you can find out everything that needs about Good Sam for AV's point of view there, or Mike, I'm sure, would be happy, and myself and others, to talk about it at the various sessions. Thank you.
I'd like to thank Tony for showing a video that made me all teary just before I was going to get up on stage. So thank you, Tony. So I'm going to just touch a little bit on our St John, New Zealand, or in fact, I'm sorry, New Zealand, because it's both St John and Wellington Free, experience so far with Good Sam. I'd like to thank Bridget Dicker not only for her huge amount of work in getting Good Sam in, but for also letting me use her presentation. So thank you, Bridget. So a lot of what is in this presentation Tony has already discussed, so I'm going to go through quite a bit of this quite quickly to save repetition and then maximise the amount of time we have for discussion afterwards. We went through the same process in New Zealand. We recognised that with all the best will in the world and with all the best increase in resources, we were not most of the time going to get there in the first 4 to 5 minutes. but we can get bystanders there in the first 4 to 5 minutes. And we all talk about the 10% in reduction in survival per minute, but it's more than 10% in the first 5 minutes, and it's probably more like 15 to 20% during that time, and that's the absolute crucial time. In New Zealand, this is all comers. This is all comers. This is children and adults, all comers who receive a resuscitation attempt by emergency service personnel. We're sitting at 12%, and we recognise that one of the key factors to improving that 12% is bystanders. We evaluated 4 apps, and we ended up getting down to 2, and then we evaluated those 2, and we ended up with Good Sam. I won't go into all the reasons why. It seemed to be the best fit for us at the time, but I think it's important that you evaluate it yourself. I do think I own no shares in Good Sam. I don't think you can get shares in Good Sam. I do think there's an advantage, if we can, to having the same app across as many states and countries as we can, because it means that when you cross states and cross countries, you're still a responder. And not at all criticising the St John Western Australian app, but you do need to look at the apps and make your own decision. But one of the advantages is that if Tony tomorrow is near a cardiac arrest here in New Zealand, he's going to get responded. And if I'm in Victoria and I'm close to a cardiac arrest, I'm going to be responded. Tony's already touched on this, so I'm not going to go into it, but we know that lots of people are close by. They just don't know about the cardiac arrest. I love the story at 4 o'clock in the morning. I'm not going to say who, but one of our own paramedics responded to neighbour at 4 o'clock in the morning and had to put pyjamas on in order to respond to the cardiac arrest. I will just... Which one of these had the video in it? Doesn't appear to be... Yeah, that one there. So we're just going to play a very brief video which just explains how Good Sam works. Thank you. So that gives you a good idea of how it works. So we have decided, after quite a lot of discussion with our clinical governance group, on a couple of controversial things in New Zealand. We think it's the right thing to do, but it's an area where we are perhaps being a little bit innovative. So in addition to members of the public, we have a large number of members of the public, and Bridget's going to touch on this afternoon when we talk about CPR training, who have been trained in CPR but don't have a certificate. So in New Zealand, in order to provide a certificate at the end of the course, you have to have a certificated course. And that course has to meet a whole lot of requirements in order to be certificated. Those requirements are such that you have to spend a lot of money in order to be certificated, and that means that you usually, in order to recoup your costs, have to charge some money or pay for the course yourself for those people to turn up. And then you have to go through an ongoing process every year to remain certificated. We've rolled out a course that we stole actually from Ambulance Victoria and slightly renamed the 3 Steps for Life program. And we've now stole it back. We've now got thousands and thousands of New Zealand public who have been trained in the 3 Steps for Life but don't have a certificate. And we have focused that training in small town New Zealand on the basis that they are most likely to respond within their own community. And so our view was that those people in small town New Zealand have probably the biggest gain to be made by Good Sam, but by not allowing those people to sign up, we were losing the opportunity for those people to help. So we've made a controversial decision that as long as you provide us with photo ID, and as long as you tell us you're prepared to respond and do CPR, that's good enough for us. And we are signing those members of the public up. For other trained personnel, for example, fire, police, ambulance, doctors and nurses, we're requiring them to show, for example, their registration, or an ambulance circles their ambulance ID, because our plan in the future is to respond that subset of responders to different events. For example, you could dispatch your, not dispatch, wrong word, you could alert your fire, ambulance and police personnel to 29s. And your members of the public to your 9. So there's a lot of other things that we can use Good Sam for. We have also controversially made a decision that we will respond people to private addresses. In New Zealand, over 75% of cardiac arrest occurs at private addresses, and it just seemed nuts to us not to include private addresses, but that is controversial. We have a code of conduct, and people are required to sign up to the code of conduct. Controversially, and again we thought about New Zealand, we're not saying don't drive. In the UK, they've said don't drive. In rural New Zealand, it's just totally unrealistic to expect that people aren't going to drive. And we spent a lot of time talking about it and thinking about it. But we know that actually in small town New Zealand, what happens is they dial 111 and then they think, oh shivers, I'll give Tony a call, I know he's a paramedic. So they call each other anyway, and we know they're driving anyway. So actually we just thought, as long as we've got a code of conduct, which says what code of conduct, which outlines what you need to do, we are going to allow people to drive. We have more determinants than Ambulance Victoria, as you can see, that we will respond people to. But similar to Ambulance Victoria, there are a number of determinants we looked at and went, actually we think this would be inappropriate. And our goal in the future is to start to align the determinants to the group of responders. And for example, you know, the 29s, particularly the 29 deltas, and you've got fire, police and ambulance personnel who are off duty and close by, and it would make sense to us to alert those people to the presence of that 29. We spent a bit of time, not a bit of time, we spent a lot of time thinking about how we would stand Good Sam responders down if you had alerted them and then discovered that the scene was unsafe. So we have an existing short code that goes into our CAD. So if that short code goes into the CAD, it will trigger the Good Sam responder, or it will trigger their phone to stand down. Now what we've discovered in a couple of cases is they've received the alert to stand down, but in their excitement of responding, they've not seen it. And so we're just continually reminding all responders that, you know, particularly when you're going to a private address, you just need to stop and assess safety before you enter the scene. Having said that, we haven't encountered anyone walking into an unsafe scene yet. It's bound to happen one day. It's just statistically going to happen. So we launched in April 2018. 3,000, unfortunately, I'm trying to compete with Ambulance Victoria, of course. Not that we're competitive. Doesn't include Wellington Free, and it doesn't include fire. So we actually think we're up around the 3,500 mark, but I can't say for sure. But we are we are actively competing with Ambulance Victoria. And so far, we've had 4% attended by a Good Sam responder. Now, that 4% is low, and we're absolutely looking for that number to go up. We don't yet have any absolute obvious saves in the way that Ambulance Victoria have a couple of absolute obvious saves. We've had some cases where they've arrived and done bystander CPR long before anyone else. And I've certainly had one where I arrived with an AED at exactly the same time that fire did. So we literally walked into the address shoulder by shoulder, but we haven't yet, that I know of, Bridget, had an absolute, got their CPR, used an AED, had ROSC prior to services arrival? Okay, so we've got our first one. Okay, great. I hadn't heard about that.
One of our clinical support officers at a rural pub room standing next to the AED has been seen off.
Okay. Great. Okay, we need to, separately, we need to talk about that. We need to make something of that. And as you can see, these are early days, and our goal is to expand this significantly. So there are a large number of people involved in getting this across the line for New Zealand, and I just want to thank all of those people.